Hello and good afternoon, everyone. I am Candace Weber, Chief of Partnerships at the Louisiana Policy Institute for Children. I will be guiding this lunchtime discussion, so thank you for joining. At the Policy Institute, we have built a growing body of work around early educator compensation. And before we open up for our panel discussion for this afternoon, I do want to ground us in a recent study that was done on early educator compensation by Dr. Stephen Barnes, who is the director of the Blanco Public Policy Center, and Dr. Jordan Thibodeau, who is the Associate Director of Research, also at the Blanco Public Policy Center in Lafayette. And so, again, they conducted a recent study on early educator compensation and explored whether increased pay could improve retention and the quality of care in child care centers. And so I'd like for them just to share the study, its findings, before we're joined by others involved in the research to discuss the implications and answer questions. So at this time, I'm going to turn it over and welcome Dr. Stephen Barnes and Dr. Jordan Thibodeau to present their research.
All right, thank you for the introduction, and we are excited to be here to engage in some discussion around teacher pay, but also to kick things off with an overview of some recent research that we have done at the Blanco Center. So what we'll talk about today is the culmination of a little over 3 years of collaborative work at the Blanco Center. There's quite a few others on our team that have helped contribute to this project in different ways, but certainly wanted to call out Eric Mills, who is a co-author on our final research report. But happy to have Jordan Thibodeau here with me today to share in the presentation. With that said, if we can advance the slide, and I'll share a little more background in terms of the context and some of the thinking that led into this initiative. So this really dates back to conversations that we were part of with the Louisiana Department of Education in the early years following the pandemic. There were great concerns about stability in the child care sector as the economy was beginning to reopen and people were trying to get back to work. This was identified as a critical area of concern to make sure not only that we could reopen child care centers and resume operations there in a safe way, but that we could support centers and support teachers in ways that would provide additional stability in the marketplace, so that not only could child care centers serve the families and children, but that at a much broader way, we could make sure that child care was available for workers as they went back into the workplace and try to get the economy back up and running at full speed. So with that being said, I think we were wrestling with some challenges that predated the pandemic, some long-standing challenges, and we were looking to research being done in other parts of the country to help generate potential solutions to address this challenge of teacher retention and teacher turnover with a focus on teacher pay. So we'll share some data in a little bit on this, but as all of you are likely aware, wages in the childcare sector are generally fairly low, even as we see in Louisiana relative to other states. And this is something that somewhat flows out of a tight marketplace and tight business model for childcare center operators, that we don't see the resources to support much higher payments by families necessarily. And so we've got lean businesses that are trying to help make ends meet and cover all of the necessary expenses. And one of the pieces of that equation is not a lot of flexibility necessarily to see wages at a much higher level than where we are now. So this is a challenge, a longstanding challenge for childcare centers. But paired with that is a historical pattern that we continue to see now of fairly high turnover in the childcare sector. So for people who move into this field, especially as new entrants, the rate of pay that is common and widespread is something that makes it difficult to compete with a large set of other entry-level positions across the economy. And some of the historical data that had been done specifically, historical research looking specifically at Louisiana, suggested that in the early 2020s, turnover in the childcare sector at a 1 year mark was somewhere near 50%. So that's a really high rate of turnover, which of course produces an array of challenges for centers and for families. We modeled this effort off of several sort of short-term incentive programs that look to give teachers additional supplements, and we saw those happening in North Carolina, Tennessee, and Virginia. And we took up something really similar here to try to give teachers supplemental pay as a way to try to help stabilize the marketplace and keep them in those childcare centers. So I think with all that background being said, we'll move forward and talk a little bit more about exactly what this program looked like. So this was a 2-year-long grant initiative to give childcare centers, type 3 childcare centers in particular, additional funding to pay full-time teachers, supplemental stipends to encourage them to stay on the job and continue to provide the care that is so important. This was funded through one-time allotment of federal funds. Again, this was a time when this challenge was not unique to Louisiana, but something that was perceived as a widespread challenge to help stabilize the marketplace and ensure that childcare centers could be open, especially during a period of time when attendance for students might be a little more hit or miss, given lingering sickness and challenges related to the pandemic. That would keep families home or kids home, and sometimes even teachers home at unexpected points in time. But one of the limitations was this was not only one-time money, but we had a fixed amount of money that had been committed to support this program. And when we opened up applications, we saw enormous demand for the program amongst type 3 centers. And that left us in a position where we did not have grant funds to give those supplements to every single childcare center. That set us up to use a randomization process to decide where those dollars would go. And we ended up with 3 different groups in this grant program. Every childcare center got a minimum of $1,000, which was committed to supporting administration and ensuring that we could continue collecting data throughout the program. That was $500 a year, but roughly a third of the centers that applied were given additional grant funding large enough to be able to give their teachers a 10% bonus on each paycheck for a 2-year period. And then another third of centers were given enough funding to be able to give each of their teachers roughly $2,080 per year, but spread out across their paychecks. And those 2 different designs were intended to help us get a little bit more of an understanding of how much additional pay it really helps to move the needle in terms of turnover. Knowing that about $1 an hour is what that $2,080 per year works out to be. And what we had seen in some other states was that $1 an hour suggested it would, from their early evidence, that it might have a really large and important impact on reducing turnover. That 10% group was intended to give us a little more variability, with teachers making $8 or $9 an hour getting 80 cents or 90 cents, whereas teachers making 12 or 15 would get slightly larger raises, so we could get a better understanding of whether we saw big differences on the lower end or the higher end of that as well, with a hope that this would bring information forward to help long-term guide decisions both at the state level and at the center level to stabilize centers and ensure that teachers were compensated in a way that could help keep them in the classroom long-term. I'm going to hand it over to Jordan to share a little bit more about the results, and we'll move forward from there.
All right, thank you, Stephen. As Stephen said, we had these centers, just to highlight the visual here, centers across the state recruited for the study into 3 equally assigned groups to receive the pay stipend or to be in a comparison group of no pay treatment. So I will talk about the results related to that. I want to highlight overall what we see in the study data that was collected on teachers for their pay, which is kind of the main picture of this, the data that you're looking at here. So the panels I'll walk through, but the first one, major one, being this kind of mountain landscape looking profile. It gives us a pretty good estimate of what teachers are making hourly in the state. This is our sample of over 7,000 teachers. And you can see the data, the call outs there on the peaks of those mountains is that the most frequent wage that teachers in the study at Type 3 centers were earning is $10 an hour. The average was around $12 an hour, and the median was somewhere close to that. So notice also there's a little bit of a tail to the end of this, where we did have some higher earning individuals participating in the study. Those individuals were teachers, but also were center directors and had, other staff responsibilities. But I think it speaks to the overall picture of the study that we captured in this sample, a largely reflective picture of wages, hourly wages for childcare workers, childcare teachers in the state. And we actually are not that far off of estimates from the national data from the Bureau of Labor Statistics. So that upper quadrant panel there shows the annual wages estimated from BLS data. And you can glean a pretty quick picture there that the wages are lower, that they're about 30% lower than the national. And this is, to speak about just a touch on the economics of this, that this is a wage problem specifically in the state. Even though cost of living might vary from state to state, those estimates are fairly accurate, controlling for cost of living. And so what we're seeing is that this comparison begs the question of it being a wage issue. For the study's sample, just to highlight, again, the overall frame of reference that we're looking at, we had over 533 centers, over 7,500 teachers. And we found overall in the study that teacher leave for the 2-year turnover rate was 48%. So hovering around what Louisiana would get for 1 year, but hitting that mark at 1 year was about a third of teachers gone, and then we started to see it continually climb to this final estimate after 24 months of data. So this is kind of the overall picture here. Drawing back to the importance of looking at wages and sufficiency within this population. Now I'm going to take it into the study's main hypothesis or main question, which is, does the incentive, does the intervention of about $1 an hour and or proportionate increase help? Okay, so I know we're all waiting for that one. The main thing here is we have our ability to look at the data over different factors and different types of important layers in the data. So the way that I've presented this here is I have our 3 groups, our control, our awarded 10%, our awarded 20/80, showing you the change in pay and the change in the likelihood that they will turn over, okay, or a reduction in that likelihood of turnover. So this is kind of a prediction of those things based on the data. And what we were able to do is take separate kind of profiles, slopes, if you will, of these centers and compare them. So you can see across these different graphs that there's a pretty noticeable change in $3 to $4 amount between these groups and the likelihood of turnover, particularly within the $12 to $17 range. Remember that the the median tends to hover just below that. And so that's probably why we're seeing the 50% turnover rate at that level. Whereas as you gradually move away from that, you start to see reductions in turnover. We were able to look at the data specifically over time, and we found overall that these groups behaved very similarly over time. So the main conclusion of this slide here is that we did find a relationship between pay and turnover, but we did not find an effect of the cash incentive to boost retention. So these three groups are not statistically different or meaningfully different from each other in terms of the effect of the intervention. And we have a pretty precise way of determining that through statistics, but you can see there's a lot of overlap between these groups, even evident on this slide here. So I'll next kind of talk a little bit about some additional things that we examined just as a segue into discussion. But I think it's worth mentioning that we considered, as a team, we considered a whole host of other variables that might be important to this. We know that some factors related to the center environment are important, the center capacity are important. We just highlighted a little bit on this previous slide that teacher hourly pay is important. And the education of the workforce itself is really important. Those teacher education and training aspects of the child care teacher entering the workforce are very important human service jobs dealing with children. So what we did find actually in our data is that along with teacher hourly pay being positively related to retention, so is center performance. So, and that's actually using the data from center level measurement that's collected by the state. So these are profiles on centers where their ranking is on the quality of the center. And there's a lot of ingredients that go into that. Part of it comes from teacher quality and just kind of the overall environment. But every center is assigned a performance score. And what we found in the data is that centers with higher levels of performance tend to retain more teachers. That's an association that could go in different directions. We could talk about, why that's important, but that's the main thing there is center performance. Finally, education of teachers. The way we looked at this, there's a lot of different ways you can split it into teachers that have a degree versus teachers that don't have a degree. You can look at it by different things like child development associate training or special types of certificates that are offered in the state for child care continuing education. And we looked at it in lots of different ways. And again, across the board, a more educated teacher workforce is related to a higher retention. So there are other factors to explore into the nature of this study that we don't necessarily have time to go into for the presentation, but for discussion. And I just want to leave it there and kind of come to the summary and conclusion here, where our main conclusion of the study is that an increase at the level of $1 an hour did not boost retention. And that's markedly different from the conclusion of other states that have looked at this with similar approaches to what we use, but slight variations in how they had the money available and what they did with the money to allot it over time as a stipend. Or they may have included other elements to receiving the money, like you get the cash incentive if you get continuing education credits. You get the money as part of a career ladder program within the state that addresses a whole host of other workforce issues. So it's still important to highlight that the results point to the importance of common drivers of retention within child care centers, as I had alluded to on the previous slide. And I'm going to let Stephen take it back here to discuss some of the things that we as a team are considering for future directions with this research.
Yeah, thank you, Jordan. I just wanted to add a few more thoughts on, what we know now and what we what we hope to continue exploring to bring additional insights into this conversation about teacher pay and retention and creating that stable, high quality environment for children at child care centers in Louisiana. I think this cross-sectional pattern, across all of our teachers, seeing that teachers that are at higher rates of pay are far more likely to stick around, does sit in tension with the focus of our study, which was to sort of randomly give some teachers a little bit of extra pay, and this broad pattern that higher pay is associated with lower turnover, you might think suggests that we should see turnover drop when we give teachers additional pay. But I think the big question there was, would $1 an hour be sufficient? And again, we started with that because we saw that in other states. But even thinking back to some of those benchmarks that Jordan shared previously, the rate of pay in Louisiana is, depending on what measure you look at, somewhere between 25 and 30% lower than national averages for teachers in this setting. Yes, Louisiana is a bit of a lower income state, but that really only accounts for part of the story, because well-done measures suggest that our cost of living is only about 10% lower than the national benchmark. So we're seeing really a more acute challenge here for teachers in this setting, seeing considerably lower pay in a way that's far beyond what might seem like a cost of living related factor. And so when we know we heard back from centers that received these funds that every dollar matters, and they were very appreciative, and the teachers who received these funds were relieved to have the additional resources, but it wasn't enough to move the overall marketplace. And so we want to explore that a little further. Partway through this initiative, there was another effort in New Orleans, kind of a targeted, more regional effort to do something similar to provide additional dollars to teachers. And so that's something we'd like to revisit and see if we can kind of layer that information on top of what we looked at in this study. That'll give us a better understanding of whether ultimately larger incentives move the needle in a bigger way there. And that may be something that generates insights that we can share statewide to help better inform decision-making on teacher pay. And also looking at a better understanding of where people went. So that's work that again, we hope we can pursue to kind of extend this research a bit further and understand, when people left these positions, what kinds of jobs did they move into? And thanks to a legislatively created longitudinal data system that we are managing at the Blanco Center, I think there's an opportunity to explore those kinds of questions further. But we'll leave it there and eager to open it up for discussion with the group.
All right. Well, thank you. Very interesting. Of course, I will reserve my own questions because I know we got to get to this panel. So how about, let me just bring up the panel. So our two additional panelists, we have Barry Carter, who is the Assistant Superintendent of Early Childhood Education at the Louisiana Department of Education. And we also have Megan Garrison. She is the owner of Young Scholars Academy in Baton Rouge, Louisiana. So welcome, welcome. And I'm just going to jump right in. Whoever wants to answer first can, but in looking at seeing the results, initial reactions, did anything stand out to you, or did anything challenge your expectations? And that's for anyone who wants to jump in, just initial reactions from the findings.
Yeah, I thought it was pretty interesting how they presented it. As from the Department of Education standpoint, that's one of the things that we wanted to look at was the workforce and how, the stability of that for early childhood educators. As a former teacher myself and an administrator in schools, I know how important teacher retention is, and always looking for different ways to retain teachers, and there's no difference in this either. So one of the things I wanted to see, personally, was the pay, just to see how big an influence it could possibly be. And so I'm kind of glad that, we got some of that information in. I think Dr. Barnes and his team did a phenomenal job at doing this research and kind of giving all that information. And obviously just to see if compensation can affect that ability and just see, the effects of what it can bring.
Fair point.
I'll want to add just an additional statistic that is gut-wrenching, but I feel is worthy of being noted, that 1 in 7 in the state of Louisiana early educators live in poverty, and we are actually trailing the basic living wages by nearly $4 an hour. I wish also appreciative to be a part of this pilot. The $1 an hour, as everyone agrees and can see, I would have liked to see increase to even possibly match like what we were trailing to that $4, if not more, to see what that data shows. We definitely see turnover firsthand and the challenges that our educators face when they're struggling to make ends meet. And I was appreciative to understand how support looks and what we can do to truly make that difference in reducing turnover. There's so much that we can't control in the environment, but there's one thing that we can do to make sure our educators are taken care of. And I hope that we can continue with the data to explore more solutions to increase the pay for our educators who need it the most.
Yes, agree. Barry, I'm going to kick it over back to you. What initially prompted the Department of Education to focus on early educator compensation?
Yeah, well, obviously, like I said before, uh, the stable the stable workplace, just making sure that when educators are getting hired, that they're staying where they're at, obviously the more that they're there, the more they're retained, the more comfortable they get in their field, the better they get in their field and keeping them there. And so we just wanted to see, what this study could do, what it would look like when it got established to promote retention, and to see what are some different factors that are affecting, you know, uh, providers across the state where they're losing teachers, and what are some of those reasons, or what are some of the things that can be done to keep them there. So just trying to pilot and looking at those areas of what can be given for more retention.
Makes sense. So Stephen and Jordan, our Q&A box is lighting up. So I'm going to just now shift to some of the results in the data. So of course, we saw that the dollar per hour increase was linked to a lower risk of turnover. But of course, when you tested pay supplements, you didn't see the significant difference as you said towards the end. Can you just kind of go a bit deeper and just kind of help us understand why the results look different? Because even in our Q&A, someone is asking about in comparison to other states, like did other states show the additional dollar made a difference starting with a higher base? I mean, we know there are several factors. We've talked about behavioral economics, kind of like what goes into it. Just kind of help us understand, like, why are the results so different in Louisiana? If you could just go a bit deeper on that explanation.
Sure, I'll jump in first, but Jordan may have some additional things to add as well. I think the the state that we really had kind of modeled this program off of was Virginia, where we had seen a program that essentially gave $1 an hour, and they saw pretty large, significant reductions in turnover. So I think that was the hope that we would see a similar experience, even though we might look back at this now and say $1 an hour, that didn't seem like enough to move the needle, and it turned out it wasn't. but we had a jumping off point from research done in other states. And I'd say this is a great example of why, something that we're always looking to do at the Blanco Center is find a starting point based in what we already know, but then work to see if we can replicate that here in Louisiana, learn more here, and use the new insights to better understand the context. And so a couple of important things were happening. One, we were designing and launching this program at a time when the economy was undergoing very rapid change. And in fact, this is one of the rare moments in recent history, and recent in the last 10 or 20 years even, when we started to see wages at the low end of the wage distribution start to move up much more rapidly. We can all remember, and we're still feeling the effects of rapid inflation. And a lot of that inflation in the retail context was also tied up in recruiting workers back to Target and Walmart and CVS. And there were, so rates of pay in those kinds of entry level positions was going up very rapidly. So even from the point in time in the summer of 2022 to the fall of 2022, as we had launched the program and kind of moved forward with a structure in place, the atmosphere and environment was changing. And I think that that's something else that played into some of what we observed over the next 2 years. Um, but to this very question, again, I think we do have an opportunity to continue exploring. I mentioned earlier the pilot, and I don't know, Candace, if you want to say more about that, because I know the Policy Institute for Children was really instrumental in helping bringing resources to explore a similar kind of initiative to bolster childcare centers in New Orleans. But we're hopeful that we can find an opportunity to leverage some of the data that's being collected there and understand if we can pinpoint which centers might have gotten the dollar an hour through this program and gotten some additional resources to support teachers through this New Orleans-based program. That may be a great opportunity for us to be able to look at larger changes in pay and see if is that enough to move the needle. And obviously we know it's a complex issue. It's not all about pay. But if we can understand pay, hopefully that gives us a better starting point for moving the industry forward.
Yeah, absolutely. I mean, there's obviously more to the story here, right? And that is what we want to explore together. And I see one of the questions, which I think is a good segue to kind of the more to come or more to the story. Someone has, based on the study, what is the sweet spot for an hourly rate to retain staff while not decimating a center's budget? And so I think that kind of goes to like, well, we don't know yet. There's more to explore, but definitely a fair point, which actually, Megan, I'm going to kick it to you for a bit. As a child care provider, so you see firsthand the impact of turnover on your center, right? And so you also know that the high cost of providing quality care can make increasing compensation for educators challenging, right? So what are some other strategies that you found effective for reducing turnover among your teachers?
Sure. Four come to mind, and I will share those and look forward to that. When I do share those, I'm going to share what has definitely worked for us in the past, and I feel is kind of a universal practice among owners of childcare facilities. And then I want to just bring awareness to kind of what we're facing in today. So one of the biggest, I would say, would be benefits, paid time off, sick, holiday pay, things of that nature. But in today's world, we are finding that without fair, wages, that benefits alone will not keep people in the field. We're really big on celebrations. We love to celebrate birthdays, anniversaries, milestones to show our staff that they matter. But the reality in today's world is no amount of cupcakes can offset the stress of not being able to pay bills. And number three would be professional growth. We invest in our staff education and give them the leadway and a mentor to support their growth. But advancement, we're finding, only works if it translates to better pay. Teachers shouldn't earn more credentials and still struggle to afford groceries. And four would be community. Team building strengthens bonds. We've seen that. I've seen it over the past 15 years. But we're finding that pay equity strengthens that commitment. And so we know that people stay where they feel respected and secure. And I really want to highlight that word secure and what it really means to us in the industry. If educators are secure at home, they bring their best selves to the classroom. And when teachers are happy and stable, and I know all my teachers out there, I started out in the classroom, we all know that kids thrive. And it's really as straightforward as the old saying, happy teacher, happy kids. And it's not a feel-good phrase. In today, it is a workforce strategy, and we need to start treating it that way.
Absolutely. And Megan, I'm sure you don't mind me saying this. Megan has a high quality center. She has a high quality center, which actually brings me back to Jordan, something you talked about earlier about high performing centers and their ability to lower the risk of turnover. And so thinking about the higher performing centers and the scores, do you interpret that as it's strong performance that's helping to retain or keep the teachers, or is it the stable staffing, right? As you heard Megan talk about just kind of juggling turnover, which makes it easier for centers to perform well?
I think that the question actually, it took, for me, I thought about this question from both of those ends, and I really appreciate Megan's, first hand account of what quality really looks like in a center. I think I could point to just the general literature on this as a scholar in this area. That's really kind of where I am looking into this, in that so I'll start with the inverse, which is there's definitely a literature that supports the idea that turnover can be a climate in child care centers. And so turnover can be high and create sort of a perpetual repeated turnover and instability within the jobs being lost. And some of this early research kind of points to the idea that when turnover climates are present, you have a lack of benefits. As Megan pointed out, towards the staff, you kind of have a place where there's no opportunity or a lack of opportunity. And so, we can see that there are certainly going to be centers like that in which a dollar amount intervention is not going to override the quality aspects that are missing from that center, right? So it's certainly, the clearer case example. But as you move up and measure quality within the state, I know that the measure is primarily focused on teacher quality, and the pieces of that are emotion focused. The social emotional development of children becomes a piece of that, the stability of the caregiver interactions with the child and the overall class environment. So it does point to some other factors beyond pay that really do make a difference. And so those centers group those things together, and they also have really great directors who monitor their overall workforce and how they're being treated. And they probably move together as a center to be better performing and better retained. And that, of course, highlights the importance of education and training as well, where the literature does point to the idea. It's not necessarily saying strongly. There are studies that point to the importance of increasing pay to reduce turnover. But there's also plenty of evidence that points to the idea that providing teachers with education to work with children in their centers is a major booster of retention as well. So there might be a good group of teachers who are really motivated to work with kids. They're intrinsically desiring to be there, and they just drive up the performance of the center as a result of that. But the reality is that group's probably not big enough. And so we need education to support them, and we need better pay, obviously, to connect to that as a ladder. So, I think there's lots of different ways of looking at this, but the final thing I'll kind of comment on is that we've heard from center directors that it is culture, and culture really matters within the centers. And so as they move together to promote their staff's satisfaction and their well-being, they're not focused on, are we going to get a better center performance score? They're focused on the meaning in the work that they do, right? So that's kind of the culture aspect of that.
Thank you. Yes, and that seems to have sparked some additional questions that have been popping up in the chat. Speaking of, I mean, so I know you just kind of talked about some other reasons for turnover outside of pay, but did you guys come across anything like, challenging behaviors or just kind of the environmental factors? I know you saw it had it as a category, but like did anything or insights come up as it relates to, challenging behaviors, et cetera, in the center that may also be impacting retention?
I'd say in the design of this research project, we've collected data from centers, so kind of high level data about teachers, every quarter, who's still there, if people have left, how much were they making when they left. And so the design of that study didn't really lend itself to capturing a wider set of information about the center. I guess not to say that we couldn't have done so, but we focused all of our energy on trying to get a really accurate picture of the roster of teachers and rates of pay with a little bit of information about benefits. But we spent several months doing kind of retrospective reviews of those data, calling centers back, talking with them to make sure that this was really a quality control check for us, to make sure that we had a really clear and accurate picture of the teacher turnover and pay story. And in those conversations, we certainly heard a lot of those anecdotes. I think again, it wasn't collected in such a way that we can kind of give you the bulleted list from most to least important. But I think we heard a lot of things that would confirm some of those contextual pieces or some of those other qualitative factors that we heard again and again certainly do matter. But I think that continues to be an area where there's probably more future opportunity to kind of document those things and draw those things out in a way that can be more actionable for centers as well as policymakers.
So I see a couple of questions that seem around the same theme, but it says, we know that pay is important, but it's also easier said than done for a lot of us. So what would you suggest a provider do in order to reach the point of providing pay increases?
So I saw that question pop up. I wanted to offer a couple of comments on that, but I'm sure this won't be the only thoughts from the group here. I think one thing that I would like to just highlight is, this is a story that I know the Policy Institute for Children has been working to tell over time. I think this is something that we at the Blanco Center are also committed to better understanding and measuring and assessing. And as we can create a stronger body of evidence that helps to demonstrate the value of higher pay, not just in terms of stability at centers, but how that flows through to benefits for kids and the importance of those early years and preparing them for schooling so that they can have a more successful pathway through the K-12 schooling system and a lifetime of earnings, right? So that's the big long-term story as we think about the importance of creating a rich and engaging environment for our littlest kids, so they can start to learn, and that, not to set aside all the fun they need to have in those years, but that they can also be learning along the way and be getting prepared for entering schooling. And I think as we can do a better job within the state of telling that story and making those linkages, I think that will set the stage for broader changes across the marketplace. And I'm going to call out one piece of that being the state does play an important role, both in terms of regulating child care centers, but also through the CCAP program in supporting a large number of seats across the state. And that is a benchmark that can influence the broader market rates of pay. So if we have 15,000 or 20,000 children who are being supported through the CCAP program, that's something that alone may be a way that we can look to move the needle in terms of what market rates look like. And so I know that's over time. There are ongoing efforts to kind of reassess the cost of providing high quality care. And a few years ago, some of our work with the department helped to inform and kind of guide a process through which those reimbursement rates were increased. Obviously, the CCAP program operates with a certain amount of federal dollars and a certain amount of state dollars. And so it's not an easy problem for the department to solve. We don't have unlimited resources there, but I think over time doing that work to try to make sure that we can use that public program to provide a solid benchmark for pay on the revenue side, how much money is coming into the child care centers. That I think is one important mechanism through which we can create an environment where centers are able to bring in the revenue that they'll need in order to pay teachers at a higher rate. So again, I take some responsibility with a lot of what I just said there to say, I think is, for the Blanco Center, we hope to be able to produce some of the research and bring some of the data to our broader state policy decision makers. This is the legislature as our audience and state leadership under the governor, to make sure that we as a state can really understand the value of investing in early childhood, and as a more macro level way that we can bring more resources to this important area of need.
Yeah, and I want to add just a little bit to kind of other statewide initiatives that kind of fall in the area of some of the questions around behavior and difficulties within the center that make the quality much more difficult in this environment of having more overall risks to deal with. That the early childhood space is full of various kinds of staff that have varying levels of training, but you have people who are also specialists and who can really kind of see those referrals that need to take place for some kids, for some families. But I'm saying this to say that there's another sort of statewide initiative to highlight through the Louisiana Department of Health, known as Whole Health Louisiana, of which we are also part of, to plug that just a little bit. But the main idea behind it is to deliver awareness and knowledge to frontline staff in a variety of sectors, a big one being early childhood, on the use of trauma and trauma-informed care. So the recognition of child adversity as being a part of this overall, increase in what we're seeing now, as well as just kind of generally how do organizations adapt to the needs of their population. And what we know now from the science is that trauma is a universally prevalent thing, and some organizations are going to come in direct contact with that have been dealing with the problem for many years, but now we're starting to see it on such a systemic level that we need interventions at a much bigger level than the individual, community level. And so I just want to highlight that, it's the economic side, but also the developmental side of thinking about what types of interventions are going to work for this population. Trauma-informed care, at least for the state, is one of those promising directions. So to hopefully address some of these issues.
Yes, definitely important. It sounds like it is an important factor. In the Q&A, I think this one may be for Barry, but it's asking about just, our familiarity, or have we looked at the data from the National Early Childhood and Education Workforce Center. So they are apparently helping a few states creating career ladders and pay structures that reflect education and experience. And so it seems like they're collaborating with a few other states on this initiative. And so have we looked at the data or considered the data, at least how it plays into the overall, compensation for early educators in Louisiana?
No, we haven't really looked into that data, more intently than we have. Obviously, all the information that we've been given from Dr. Barnes and his team, we've been sharing it with all of our advisory groups as well as our council and commission. And so, we're merely just sharing the information that we're getting and just making sure that our legislature is aware of kind of where we are and what we have, making them, if they have any information that they need for us to find out, we're kind of doing that. But that's actually something that I wouldn't mind looking at more intently, though, and just seeing what these other states are doing in regards to that. And that can just provide more information on to help providers out.
For sure. Back to research. Do we know, is there a recommended or any insight around the minimum wage for early educators that would better match their expectations and responsibilities, but would also increase interest in the field? And so based on what what we know so far, do we have a recommendation, or does the data suggest a certain level just yet?
So I'll offer a few comments on that. I think when you look at a cross section of teachers and follow over time, teachers that are making more are more likely to stay. There's two possible explanations. One is they are the teachers that are really the most passionate about this work, the most committed to this work. And over time, they've been able to get some raises. And so they make more today because they stayed, as opposed to the other story, which is to say, if you pay a teacher more, that teacher is going to stay. Now, both of those things should matter. But the bigger takeaway from our finding is that the larger, more prominent pattern seems to be the former. We did see this very consistent pattern across all three groups, that the teachers that were more likely to stay were the teachers that made more. But again, when we moved the needle a little bit on that, we didn't see much of a response. It could simply be that we didn't move the needle enough. But even on the margin, there should have been some teachers who were on the fence. They weren't sure. They were entertaining another position, and they got that little bit of extra pay. And they said, okay, yeah, I'm going to stay here. So it seemed to be that the larger story from what we know today was more the driver of teachers who stick around over time, find opportunities to at least increase their pay to a degree. With all that being said, I will call out a few benchmarks that we saw in the chart Jordan showed earlier, that at a rate of pay under $10 an hour, we were seeing turnover in the 60 to 70% range. So really, really high turnover. When we looked at teachers around the $12 an hour mark, that rate of turnover over the pilot period over a 2-year period was closer to 50%. And when we saw that number closer to the $17 an hour mark, that was about 25% turnover, again, over a 2-year period. So those are some benchmarks maybe to have in mind. Again, I'm hopeful that there may be some opportunity to look at what's happening in New Orleans and see if we can unpack a richer understanding of the role of pay when we see some larger movements there. But that might be a starting point for thinking aspirationally. And again, for some centers, as you look, and again, from what we've seen in terms of long-term challenges for some, just to even keep that business in the black, let alone find ways to make big changes in rates of pay, that some of those numbers may seem out of reach, but those are maybe some aspirational numbers to keep in mind. One last thing I wanted to call out, which I had kind of neglected in some of my earlier remarks, is a recognition of some of what has been kind of starting to bubble up at the local level, right? So in Louisiana, we've created I think a good atmosphere for encouraging local initiatives to step in and address some of the childcare challenges in a particular part of the state or a particular city through state matching dollars to support local dollars. And we've seen locals step up in some big ways to really bring new resources into the marketplace. So especially some of my comments earlier, as I think about this at a statewide scale, I think there's clearly a need for more resources. But this is also something that can be addressed at a local level. And so, that may be an important parallel effort that some of the audience today may be part of, or may be ready to take up and lead on, to try to bring resources into the marketplace, to help centers be equipped to pay their teachers more, in addition to all the other things we've talked about that can be done to try to help create that rich environment that teachers want to stick around and be a part of. So so that's also another thing that we certainly want to keep an eye on as we think about ways that we can kind of document the success stories, share those out, and be able over time to make the stronger business case for why it's a smart investment to put money into early childcare.
Absolutely. And also, just shameless plug, we do have one of those local communities who is investing into their system via the fund. And so it is the Rapides Parish. Cindy Rushing will be giving a presentation on what they're doing within their region. So that will be one of our final sessions. And something else you said, Stephen, really resonated because, the Policy Institute, we have produced a report around like wage scales and what would a competitive wage really look like in Louisiana. And so it's interesting that, the thresholds that you mentioned, how the turnover is reduced. I think our starting recommended wage scale, our hourly wage was like $22 an hour. But to your point, that seems far to reach. But this is based on just basic cost of living. We utilize MIT's wage scale and different factors as well applicable to Louisiana. But I think that seems to align with what we suspect. And so really looking forward to testing that out a bit more. Question, I think we have time for one more question. And Stephen and Jordan, you both talked about it from an academic standpoint as far as like next steps to really continue to explore, but I open it up for Megan and Barry. Where do we go from here with this information? What are the next steps now that we have this information? We have an initial view. We know there's more to the story, but what are the next steps from your perspective?
Yeah, I'll go, Megan, if that's okay with you. Obviously from the department's next steps is informational, is providing that information and making sure that everyone has it and making sure that providers are being given a chance to look at it and explore that, some different options that they may have in regards to the information that they've been given with it, as well as providing that, more importantly, to our legislatures to see what we have in that, to provide them any answers they may have to it, as well as to listen to them, to see, to explore other states and to see, these other models and what they're doing, so we can take that information and give it to our advisory councils and our commissions, and to make sure everybody's aware of where we are with that. So that's kind of our next steps from a department side of what we're doing with it.
Awesome.
I think I would just echo with saying just accountability with our state as a whole. I think everyone can agree with the specific data that a higher increase, and I just want to highlight again, like benefit cliffs, as being our participant, I do want to recognize that more than half, if not close to, did not want to participate in fear of losing benefits because the $1 an hour would pose a barrier, and they didn't want to stop what they already had by chancing that because it wasn't a high enough incentive to want to try and do that. So I just want to highlight that. And again, love the work that you guys did and the intent behind it. But I will want to highlight again what Dr. Weber said with starting out at $22 an hour. We have to be realistic that if we're going to go the distance, we need to put our money where our mouth is, essentially, and have that massive change to that $22 an hour starting off for true pay parity. And then we will really see what the data is actually saying. And I know from firsthand experience that that will change when they don't have to worry about losing other benefits by doing this. Then you will see that that investment, and other statistics shows the return on investment is astronomical when you do that. And again, highlighting the economic and the workforce strategy and other areas that I think aren't being highlighted and should. And so I think that it's a win-win in every single industry, but it has to be a higher number. And I wholeheartedly recommend the starting out at $22 an hour, and also being able to support early childhood. We're often not seen as a small business or a business, and we function as two, and we need to be treated as the two that we actually represent, because in reality, 90% of our expenses is our labor associated, payroll and expenses, mortgage, that type of thing. So keeping that in mind as well, to give providers support for the true cost of care. And I want to highlight that the true cost of care looks totally different than some of this data. Just keeping that in mind to wholeheartedly support them in the way that they would need to make a lasting impact.
Thank you, Megan. Stephen, Jordan, any final remarks?
Well, I think in terms of next steps, I've already sort of offered the standard researcher idea, which is more research. So there's some things that we have planned at the Blanco Center to continue to push, offering what we can to this conversation. But I certainly think there is a lot happening across the state, locally led initiatives, and I would encourage those listening today to to continue pushing forward if they're already involved in some of those. Look for ways to try to create those local coalitions if they're not yet involved in some of those. But we'll certainly take with us in our continued work a lot of the perspective that we've heard today, and we've heard from some other providers about making sure that we're thinking holistically about what these center operations look like, and the real challenges in trying to help accomplish all of the goals: taking care of kids, taking care of teachers, and making small businesses succeed. So I'll leave it there.
All right. Well, thank you all for your valuable insights today. You all have been a great panel. Lots of discussion, lots for us to think about. And like we said, there is obviously more to this story. And so thank you all for being with us for this very important discussion. Final workshop sessions of the day will begin at 1:05. So you have enough time for a quick break, and we'll be back shortly for our final session. So thank you all again, and we'll see you in the next session. Here.